So my name's Bruce Levett. I'm the CEO of Health Consumers Tasmania. So Health Consumers Tasmania is a organisation that's independent. I report to an independent board. We're community-led and consumer-led. So a community non-for-profit organisation. Our aim as an organisation is to empower the Tasmanian community to have their voices heard and to have input into the health system across Tasmania so it better meets their needs. So the Tasmanian Collaboration for Health Improvement for us as an organisation is really important because it enables the community and health consumers to have input into research that then informs services across Tasmania. Tasmanian Collaboration for Health Improvement is really important for a number of reasons. From our perspective, it helps coordinate a community voice to help drive research across Tasmania. So from a health research perspective, the community voice is central to actually identify what areas are important to them. It can actually help focus the research and for Tasmania to develop a strategic competitive advantage in health research areas that are important to Tasmanians. The Tasmanian Collaboration for Health Improvement is really important because the research that we find is that the community often doesn't have input into the health system. So it doesn't have input into the research in a way that actually shapes the research. It doesn't have significant input into shaping service delivery, service design and service outcomes. So the collaboration will actually ensure that that community voice is central, that health research isn't undertaken in isolation, but it's driven by the community, it's driven by the health needs of Tasmanians, and the aim is that if the research is done and is driven by the Tasmanians, then they're more likely to be engaged, to support the research and support the outcomes. To have health research that's meaningful for Tasmanians, they need to understand why the research is undertaken. They need to understand how it impacts on their lives on a day-to-day basis. So the health translation component of the research is really important so that Tasmanians can understand how it impacts on their day-to-day lives. So from Health Consumers Tasmanian's perspective, consumer engagement covers a lot of different spectrums. So from our perspective, it's really important that consumers lead research and they lead input into services that impact on them. So leading doesn't mean just being consulted or engaged. It's about how you engage consumers to help co-design research and service delivery, and how you get consumers to actually lead the delivery of that research and the service delivery that comes out of it. So from our perspective, having consumers engaged right through that whole spectrum is critical so that they're not just part of being consulted, but they actually help lead in the work that occurs.